Thank you for joining us today for this crucial discussion on heart health and our Save Your Heart campaign. This is the last installment of the 3 companion video series that will guide you through a compelling journey that reveals the hidden epidemic of heart attacks in America and offers a solution that can save countless lives. But here's the kicker. We have the knowledge and technology to prevent many of these heart attacks. We know how to stop them from happening. The economic burden of cardiovascular disease, with heart attacks as a major component, is nearly $1 billion a day. Just think about the immense toll it takes on our society, both in terms of human lives and economic costs. So, what's holding us back? Why are we still facing this crisis when we have the tools to prevent it? One major obstacle is the denial of access to a simple yet highly effective test called calcium scoring, as we already discussed in the first 2 videos. Imagine this test as a crystal ball that allows us to see into the future of your heart health. It's known for its reliability in detecting coronary plaques years before a heart attack. Your insurance premium includes coverage for heart attack care, which can cost from $50,000 to $100,000 and sometimes even more. I believe that your insurance also includes payment for the $100 calcium scoring that you will need once or twice during your lifetime. In the same way, it pays for mammography and colonoscopy that cost much more. The insurance executives, unfortunately including Medicare, decided to continue to deny access to an inexpensive test that can prevent a heart attack before it happens. And that's a major roadblock in our fight against heart disease. Our mission is clear. Break down the barriers, make calcium scoring accessible to all, and educate the public about its life-saving potential. It's time to open up access to this critical step in preventing heart attacks, especially after the pandemic that killed so many. But the journey doesn't end with the test itself. What's equally crucial is the effective medical therapy that follows a positive calcium score. The good news is that this therapy is already covered by your health insurance. Let's return to that staggering statistic. Over 600,000 first heart attacks every year in the United States. These are not just numbers. They represent real people, real families, and real lives forever altered by an event that, in many cases, could have been prevented. Now, let's dive deeper into the heart of the matter. You might be wondering what happens after you get that calcium scoring test and it is high. John and Mary are couples in their late 50s. They decided that it was time to try to be as healthy as they can and to look forward to a long and healthy retirement. After watching our videos, they both decided to get a calcium scoring test and paid $90 each. Their insurance refused to cover the test and they paid out of pocket as an investment for their heart health. They were both surprised how quick and simple the test was. No exercise, no IV injection, and they were done in about 30 minutes. John's calcium score was nearly 500 and Mary was 0. Your calcium score is more than just a number. It's a critical piece of information that can significantly impact your heart health. Having a calcium score of 0 puts Mary in the lowest risk category, not 0 risk but less than 1% in the next 5 years. She quit smoking 20 years ago, has prediabetes, has borderline high blood pressure, slightly overweight, tries to be active but no regular exercise. Her father had stents at 70 and her LDL cholesterol was 120. The foundation of her medical therapy is intensive lifestyle management, healthier diet, weight control, regular exercise, maintain systolic blood pressure less than 130. Statin therapy is not needed for now and repeat calcium scoring test in 3 to 5 years. John's calcium score is high at 488 with multiple plaques in all 3 major coronary arteries plus the left main coronary artery. Their approximate locations are indicated on the report. What is shown is just the tip of the iceberg because some plaques may have no detectable calcifications yet. Without intervention, if we do nothing to alter the natural progressive course of plaque buildup, John's risk of suffering a heart attack within the next 5 years is alarmingly high, over 20%. Several risk factors, such as smoking, high blood pressure, diabetes, family history, and elevated hsCRP, can further magnify this risk, pushing it to over 30%, even over 40%. As an added bonus, the same medical therapy that prevents heart attack also prevents stroke, angina, heart failure, and eliminates the future need for stents and heart bypass procedures. So, how do we prevent these dire outcomes? It all begins with understanding what's happening inside your arteries. Let us look at the anatomy of an unstable plaque. This is the central lipid core. Think of the central lipid core as the engine driving the entire system. It accumulates cholesterol over many years, setting the stage for further progression and sometimes rupture. Our treatment is laser-focused on shrinking it. These are the calcium deposits. They are part of the natural healing process in any chronic inflammation. Calcium is detectable by X-ray and allows for early detection of plaques. This is the protective fibrous cap. This one has thinned out. We want this protective shield to be thicker, strong, and intact. We want to eliminate all conditions that weakens it and cause it to rupture. The contents of the plaque and the blood don't have direct contact under normal circumstances. Interaction only occurs during a plaque rupture or erosion. Now that we understand this complex landscape, let's talk about how we can stop your heart attack before it happens. This is our prevention dial. Turn the knob from minimum to maximum possible, close to but not quite reaching 100%. You have a choice. Our strategy consists of 4 key components: inducing plaque stabilization, stopping plaque progression, preventing new plaque formation, and inducing plaque regression. There are certain conditions that cause injury to the endothelium, the inner lining of the arteries, making it weaker and more permeable to LDL particles, bringing cholesterol inside the wall. Smoking, high blood pressure, and high blood sugar are culprits. Therefore, quitting smoking, maintaining systolic blood pressure below 130, and optimizing diabetic control with an A1C below 7, or even better, below 6.5, are essential steps. Adopting a healthier diet, engaging in regular exercise, and managing your weight can also improve endothelial function. Doing all the above will probably reduce your risk by up to 20%. We want more than that. For Mary, lifestyle management is sufficient, but not for John. In a 10-year clinical trial called Look Ahead, supervised diet and exercise in overweight diabetics showed no significant cardiovascular benefit compared to placebo. The foundation of heart attack prevention among those with significant plaque buildup is to prevent and minimize the entry of more cholesterol into the plaques by reducing its concentration in the blood. That's where statin drugs come in. Whether low, moderate, or high dose, with or without ezetimibe, statins play a crucial role in this prevention strategy. In some cases, a PCSK9 inhibitor might be necessary. Here is a slide that summarizes the findings of several key placebo-controlled clinical trials, showing that in patients like John, the lower the LDL cholesterol, the better. If John's LDL cholesterol is maintained at around 40, over time, his heart attack risk can drop from high to low. That is our goal for John. Now, let's talk numbers. For John, we want to see the LDL cholesterol level maintained at less than 55 mg per deciliter, especially knowing that he has plaques in his left main coronary artery. Aim to reach this LDL goal quickly, typically within 2 to 4 months. In majority of patients, the initial dose of statin should get them to target goal. The addition of ezetimibe can avoid the need to use high-dose statin. After achieving the LDL cholesterol goal, we also check your LDL particle number to eliminate treatable residual risk. An LDL particle number less than 700 is highly desirable. By keeping the LDL particle number at a low level and improving endothelial function, much less cholesterol is able to enter the plaques. Cholesterol influx is now much less in relation to cholesterol efflux, which is the process of taking cholesterol out from the plaques via the HDL reverse cholesterol transport. As a result, inflammation within the plaque is reduced, the fibrous cap becomes thicker, the lipid core becomes smaller, the plaque is stabilized, and obstruction is reduced. You are looking at a coronary CT angiogram. Watch the marked reduction in obstruction from severe to mild in 4 years with optimal medical therapy. Here is my patient with a calcium score of 3,500, on plaque stabilizing, plaque regressing medical therapy for over 7 years and doing well without a heart attack, angina, stents, or heart bypass. I hope you're starting to see the comprehensive nature of heart attack prevention. It's not hype. It's a reality that we've been practicing for 2 decades now. So, why haven't you heard more about it? Why does the public and even some physicians remain largely unaware of these life-saving strategies? You may have seen a commercial by the American Heart Association asking for donations featuring celebrity Susan Lucci talking how stents saved her life. Why not an ad featuring a celebrity who was saved by a calcium scoring test followed by optimal medical therapy that eliminated the need for stents and heart bypass? Your health insurance already covers the costly hospitalization for a heart attack, stents, and heart bypass surgeries, which can amount to $50,000 to $100,000 or more. But here's the paradox. They continue to deny coverage for the $100 calcium scoring test, which can prevent those expensive procedures and potentially deadly heart attack in the first place. Now, let's talk about progress. Texas and New Mexico have already passed laws to mandate insurance companies to pay for the calcium scoring test. Others will surely follow, and I hope that New Jersey will be next. We are fighting for universal coverage, ensuring that all older adult Americans who need it can access this life-saving test. So, let's wrap this up. We started with the shocking reality of over 600,000 first heart attacks every year, creating an economic burden of nearly $1 billion a day. But now, we know how to fix this problem by ending the denial of access to calcium scoring, educating the public about this simple and reliable test, and making sure they understand that effective medical therapy is already covered by their health insurance. Heart attacks should not be the norm. They should be the exception. We have the knowledge and tools to make that a reality. Your heart health is worth it, and together, we can save lives and reduce the staggering toll of heart disease on our society. Thank you for your attention, and let's take action to save your heart and the hearts of countless others.